नमस्ते बेटा, खुश रहिए आप लोग। आई माई सेल्फ जीवन प्रतिष्ठा मैनेजमेंट working as an assistant professor in department of faculty of chemotherapy and diagnostics in Jyoti Vidyapeeth Women's University. It is the first state women's university in Rajasthan. Today I will discuss the topic of classic ARC, that is the classification of ARC. What are the classification and types of ARC? Today we will discuss about this. Classification: harmonious ARC, and second one is the unharmonious ARC. नमस्ते बेटा, खुश रहिए आप लोग। आई माई सेल्फ जीवन प्रतिष्ठा मैनेजमेंट working as an assistant professor in department of faculty of chemotherapy and diagnostics in Jyoti Vidyapeeth Women's University. It is the first state women's university in Rajasthan. Today I will discuss the topic of classic ARC, that is the classification of ARC. What are the classification and types of ARC? Today we will discuss about this. Classification: harmonious ARC, and second one is the unharmonious ARC. Third one is the paradoxical ARC, and then there are three types of classification: harmonious, unharmonious, and paradoxical ARC. What is harmonious ARC? Harmonious ARC is in which the angle of anomaly is equal to the objective angle of deviation. How much the deviation is in the eye, that much is the angle of anomaly. In harmonious ARC, subjective angle is equal to 0. This indicates that ARC fully corresponds to the strabismus, provides a compensation for the angle of squint, eliminates the awareness of diplopia and confusion. By this, if the angle of anomaly is equal to the objective angle of deviation, then it indicates ARC fully corresponds to the strabismus, provides all the compensation for the angle of squint, elimination of awareness of diplopia and confusion. Unharmonious is the angle of anomaly is less than the objective angle of deviation, and subjective angle is not equal to 0. What is paradoxical? Paradoxical means when the angle of anomaly is greater than the objective angle of deviation. It occurs mainly after the overcorrection of the squint surgery. When the surgeon do the squint surgery, if in that any overcorrection is present, then it is known as. Due to that overcorrection, if patient perceives the ARC, if patient got the ARC disorder, then it's known as the paradoxical ARC. Then after that, what are the tests of the retinal correspondence? The retinal correspondence, how we can check the retinal correspondence test? So clinically, the test used can be based on either of two principles. First one is the assessment of relationship between the fovea of the fixing eye and the retinal area as stimulated in the squinting eye. This includes Bagolini's striated glasses test, red filter test, synaptophore using SMP slides for measuring the objective and subjective angles, both for dot test. So these tests are used to identify the retinal correspondence. First of all, we will understand how the Bernoulli striated glasses test is done. Patient fixates a small light source after being provided with a planar lens with narrow fine striated across one meridian. Okay. Then the lenses are usually placed at 45 degree and 135 degree, and the patient fixates the distance or fixates for distance or near. If the patient is having suppression, then he or she will see the single line in the other eye, in the suppressed eye. Okay. Then what we will say, the second test is the red filter test. Patient is asked to sit comfortably, then place the trial frame in front of his or her eye, then place the red filter in front of the habitually fixating eye while the patient is looking at a small light source. Number of different responses can be elicited. Patient may report that two lights are seen, a red one and a white one. Okay. Then in esotropia, the image appears in homonymous diplopia. Homonymous means uncrossed diplopia, and if the exotropia, the image appears in the heteronomous means crossed diplopia. This represents NRC. Patient may report that only one pinkish light is in the subposition of the white fixation light is seen. This is clearly an abnormal response in presence of heterophoria. This is termed as harmonious ARC. Okay, now you understand what is harmonious ARC, and the patient report only a pinkish type of point or a light in front of the white fixation light is seen. Then the abnormal response in presence of heterophoria and is known as harmonious ARC. May report that the measured distance between the double image provides to be smaller than expected from the magnitude of deviation. This is known as the unharmonious ARC. Now the interpretation of the test is angle of anomaly is equal to the objective angle minus subjective angle. If subjective angle is equal to the objective angle, ANRC. If subjective angle is lesser than the objective angle, then ARC. If the angle of anomaly is equal to the objective angle, is harmonious ARC, and if the angle of anomaly is less than the objective angle, is unharmonious ARC. Then fourth test is the word for dot test. How we will do this word for dot test? Tell me. It is a simple utilized red-green color dissociation test. Its principle is dissociation of eye means breaking the fusion of both eye. Okay. Now consists of a box containing four different color dots arranged in diamond formation, which are illuminated internally. The two internal pens are green, and one is red and one is white. When the patient wears red-green glasses, it is also known as the Armstrong glasses, as a convention red in front of the light and green in front of the left, can be performed separately for distance and near vision. If the patient has seen all the four dots, then it is a patient of normal binocular response with no manifestation is deviation. But if the NRC with no heterophoria, harmonious ARC with very best squint. If the patient is having the squint and he or she can see all the 4 dots with the 2 green, 1 red and 1 white pinkish, so the patient is ARC. And then when the patient will able to see the 5 dots, then the patient is having the uncrossed diplopia with esotropia. Red dot appear to the right. Crossed diplopia with exotropia. Red dots appear to the left and the left of the green dots. 3 green dots, suppression of right eye. 2 red dots, suppression of left eye. Now, what is hearing Beljowski after image test? Listen it very carefully. It is very important and somewhat tough also. Highly dissociating orthoptic test in which battery-powered camera flash is used to produce a vertical after image in one eye and a horizontal after image in the another eye. What is the procedure of this test? If patient is asked to sit comfortably, then each eye fixate on the center black and mark of a glowing filament horizontally to the better eye, vertically to the poorer eye for 20 seconds in a darkened room. Patient indicates the relative position of the 2 gaps in the center of each after image. Patient indicates the relative position of the 2 gaps in the center of each after image. Gaps correspond to a visual direction and of each fovea if central fixation is present. Then the displacement between the center of the 2 after image is proportional to the angle of anomaly. Okay, now we will study about the foveo or foveal test of Cooper's. Cooper's test are retinal correspondence and determines whether the 2 foveas have common different visual directions, common visual direction or different visual direction. We have to identify this. For this, we are having a test that is known as the foveal test of Cooper's. It permits qualitative analysis of the angle of anomaly when eccentric fixation is present. Now we will study about the treatment of ARC. Not treatment, only the management. Occlusion prevention as well as curative measures. Prolonged alternating occlusion is not recommended to prevent further development of ARC as well as NRC. Now, exercises with major amblyoscope, stimulation of the foveal area. Kinetic biretinal stimulation means that what the foveal area, actual foveal area is not developed, so give that exercises by which the foveal area is stimulated. And occlusion preventive therapy is also a choice of treatment for the patient of ARC. And exercises with major amblyoscope also is a treatment. By amblyoscope is also a treatment of strabismus. Occlusion preventive as well as the exercises which by the amblyoscope. Thank you, beta. For next video, up to the next video, all the best. Have a great day. If any query, then comment in comment box. Have a nice day. So exotropia is on opposite to the esophagia and esotropia. Okay. Now I want to explain about the people who are having exotropia or who experience cross-diplopia. Intermittent exotropia is a fairly common condition. Sensory exotropia occurs in the presence of poor vision. Infantile exotropia is seen during the first year of the life and is usually common in essential exotropia, which usually becomes apparent several years later. Now, what is the brain ability to see three-dimensional objects depending on proper alignment of the eyes? When both eyes are properly aligned and aimed at the same target, the visual portion of the brain fuses the forms into the single image. When one eye is turned inverted, outward, upward or downward, the two different pictures are sent to the brain. This causes loss of depth perception and binocular vision. This is the exotropia is the outward and deviated part of the eye. Individual can suffer from several tropias at once. In Graves' ophthalmology, it is not uncommon to see an esotropia due to pathology of the medial rectus muscle and the comorbid with hypotropia due to the pathology of the inferior rectus muscle. Now, you may ask, what is Graves' ophthalmology? Graves' ophthalmology is also known as the thyroid eye disease. It is an autoimmune inflammatory disorder of the orbit and preorbital tissues characterized by upper eyelid retraction, lid lag, swelling, redness, conjunctivitis, and bulging eyes. It occurs most commonly in individuals with Graves' disease and less commonly in individuals with those who are euthyroids. Okay, it is a part of systemic processes with variably expression in the eyes, thyroid and skin caused by autoantibodies that bind to tissues in those organs. The autoantibodies target the fibroblasts in the eye muscle, and those fibroblasts can differentiate into fat cells. So, have you all understand what the Graves' ophthalmology and how it is related to our eye, and exotropia, esotropia, hypertropia, and I want to also explain that what is hypertropia. Hypertropia means the eyes are upwards. Okay, in condition misalignment of the eye where the visual axis of one eye is higher than the fellow fixating eye. Okay, hypertropia is the similar condition, focus being on the eye with the visual axis lower than the fellow fixating eye. Now, dissociating vertical deviation in a physical type of hypertropia leading to slow upward drift of one and rarely both eyes, usually when the patient is inattentive. Okay, now you have understand what is Hirschberg, what is esotropia and all that. That's all for today's topic. If you are having any of the query, then comment in comment box, and till that, have a nice day. All the best. नमस्ते बेटा, खुश रहिए आप लोग.